name is Calliope. I'll be the nurse practitioner who is conducting your exam today. So I was taking a look at your chart, and I see that you are coming in here for a reason, yeah? Okay, well, we'll get to that in just a second. Would you mind just confirming your name and date of birth? Okay. And is that the name you prefer to go by, or do you have a nickname you like more? Anything like that? Okay. Very good. So, tell me a little bit about these headaches that you're having. Okay, so it's a throbbing sort of pain on one side, the other, both. Tends to be one-sided, okay. Good, alright. And what else accompanies this headache? Okay, you get pretty tired before, after, during, all three, okay. And nausea, okay. And anything else? Okay, so it feels like things are too bright, too loud, too much. So we're going to put sensory sensitivity down, okay. Would you mind telling me where this typically hurts for you? Okay. Do you mind if I palpate around? Okay. So, just let me know if any of this feels painful, tender. No? Let's get more into the back here. This side. Other side. Okay, nothing. So, is this throbbing pain, does it stay primarily in one spot? Does it radiate? Do you feel it other places as well? Okay. And last couple questions. How often has this been occurring for you? Okay, 2 to 3 times a month. And do you have a family history of migraine at all? Okay, you don't think so, but you don't know. Okay. And what medications are you currently taking? Okay. Yeah, I do have those on here. Okay. Well, like I alluded to, it sounds like you are dealing with migraine, which can have all sorts of symptoms that aren't just a headache. For example, I'm just gonna feel around your head while I'm chatting here. For example, I had a period of about 6 months where I would get migraine where I would lose my entire vision in my left eye, I believe. And that's very scary if you've never had that happen before. And then it stopped for about 5 years, and then I had one pop up, And it freaked me out so bad because I just suddenly lost vision in one of my eyes. So, in my case, they were caused by extreme stress. So, when that went away, then they were gone. So we're going to talk a little bit more about what we can do for you, what might be causing this as we do our exam, okay? Since you are having multiple symptoms, I just want to do the full kit and caboodle, okay? Alright, so let's go ahead and just take a look at your face now, okay? Do you mind if I feel around? Okay. Again, let me know if anything's tender at all. So, have you been feeling a lot of stress lately? Yeah. And have you been getting enough sleep? Okay, and how's your diet? Okay, so there's a few simple, easy things that we can hone in on if we notice maybe the diet's not quite right or someone is getting very little sleep. But for example, some migraine seems to be linked, goes hand in hand with hormonal cycles, which we would need to do further testing. For that, you can't just ask, how have your hormones been, unless you have those tests and those numbers. Okay, I'm going to just take a look at your ears, okay? Alright, look inside your ears. So I'm just going to pull the ear back, then look right here, okay? So let me know if anything doesn't feel right. So, not sure about family history of migraine. Has this happened at any other time in your life? No, just recently. Okay. I'm just gonna look at your other ear now. Okay. There we go. So yeah, beyond the basics, most of what I can do is just refer you to a neurologist to make sure that we are actually dealing with migraine as opposed to something more serious. Or if we are dealing with more of, I don't want to say just a headache, but we can do a little bit more with just a headache. We can do physical therapy, for example, that tends to help quite a few people with headaches. Migraine's a little less responsive to that. So let's go ahead and just jot some things down. We really want to make sure we know what beast we're dealing with, because the treatment depends on what is actually going on. Let me check your lymph nodes. Make sure you're not fighting anything off. So I'm going to go around and just with the back of the head here. You haven't been sick lately? No. Just allergies, yeah. Yeah, those got real bad for a second. Ragweed. Yeah, we're going to be dealing with the goldenrod here soon. That's just a pollen powerhouse. Okay, now underneath the jaw. So, luckily these days there are tons of options for medication for migraine. I mean, there's a lot of interventions that can be done. But we'll talk in a bit about what you can do on your own while we're waiting for neurology to see you, to make sure that it's nothing other than migraine. So, I know you said you had some sensory sensitivity, right? Bright lights, loud noises, that sort of thing. So, I have a little light here. It is quite bright. Do let me know if this is too much, okay? But I do want to check on your eyes. Alright, go ahead and just look at my nose here. Okay. We just want to make sure we're covering all of our bases, because sometimes the explanation is very simple. We want to make sure if we hear hoofbeats, we think horses, not zebras, is how this commonly goes. Rule out the most likely, most common things first, and then I can hand the reins over to someone who can do a bit more in-depth work, and I've done all the basics for them so that they can just focus on their specialty. Doing okay with the sensitivity? Okay, just wanted to make sure. Good, okay. Would you mind just following this light using only your eyes? Okay, don't move your head. Alright, we're just going to come all the way in here and just follow this back out. And I'm just watching your eyes accommodate to the different distances. Okay, back in, and we'll switch to the other side here. So right here. Okay, we're coming in and out. I'm a little shaky here, forgive me. I did some quite thorough weeding in my garden yesterday. Apparently went real hard. My muscles are a little tired still. Good. Okay. Alright, so our pupils are equal, round. They react to the light, and we do have accommodation, normal accommodation. Let's just jot that down so there are no abnormalities with the eyes or the lymph nodes. Okay, so again, we're trying to rule out headache triggers. So I'm going to be working with your sinus cavities. Sinus headaches are particularly horrible. We want to rule that out as well. I'm going to be pressing along the sinuses as well as tapping, which can be a little bit of an accentuation maneuver there. So I'm just going to press here. Do let me know if any of this is painful or tender. Just want to be able to rule that out. Okay, and how about here? The maxillary nodes, or the maxillary sinuses rather. Still thinking about lymph nodes. Okay, all good. Alright, well, here comes the tapping. So, pressure can be pretty uncomfortable when you have sinus issues, but tapping on them feels particularly egregious. So, again, anything feels uncomfortable, just let me know. All good? Okay. I would know pretty quickly. Okay, and that's normal too. Would you mind doing me a favor and just bending down and see if there's any change in the pressure in your head or in your face? Yep, just bend down real quick and stay there for, let's give it about 5 seconds. See if anything starts really aching. Okay. And anything there? No. Okay. So, why don't we look at your nose, your mouth, and your throat? So, if I could have you tip your head back so we can look at the inside of the nose here. Just gonna look inside. There we go. And right there. Okay. Good. So nothing looks swollen, blocked. And everything looks in normal alignment, the septum there. Now let's look at your mouth and your throat. So if I could just have you open your mouth. I'm going to look around. Teeth here. And just the sides of the mouth here, underneath the lip, the top lip here. Good, okay. And if I could just have you say ah. Okay, so looks like the throat wall smooth, pink, doesn't look irritated. Okay, and you just say ah again. Yeah. Okay. Go ahead and close your mouth. Alright, so let's go ahead and just take a listen to your heart and your lungs to start. And let's start with your lungs. So if I could have you just breathe in and out. Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. And out. Breathe in and out. Breathe in, breathe out. All right, and would you mind just flipping around real quick? Listen to your lungs, your posterior chest wall here. Breathe in, breathe out. Breathe in, breathe out. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. You could just put back down. Good. Let's go ahead and take a listen to your heart here. Just listen to a few cycles of your heart on each valve here. Make sure all those sound correct. Okay. And then I'm going to listen to the abdomen. So just breathe normally here. Just listening for a few seconds, 2 to 3 seconds, each little spot, a few spots, each quadrant. Good. Okay. There we are. Okay, so I'd like to just feel around the abdomen for a moment if you don't mind. Okay? Do let me know if there's any pain or tenderness here. Is that all fine? Okay. Everything feels fine. So we are going to check your reflexes now. So I have a reflex hammer called the Berliner. A little bit of an odd dude here. but we are going to start with your foot, and then we'll just work our way up, okay? Alright, so if you could just put your foot on my knee here. Okay, I'm going to maneuver you a little bit. And you just relax your foot. Just let all the weight go out of it. All the tension. Just let it sit real heavy. You're not trying to hold it up. Okay. I'm just going to hold on to your foot. We're going to tap on the back of your ankle. Nope. Just like that. Okay. So if you could put your other foot up here and just do the same thing. Yep, just let everything go floppy. Okay, and I'll maneuver you. And then we can do our tapping. Good. Okay. And now if you could just let your legs hang nice and loose. Good. Okay. And this one's pretty easy. Good. Yep. Okay. So, now I'm going to have you put your arm in the space between your legs with your elbow resting on your leg so that you can just let that go floppy. Okay, just let it hang loose. Okay, I'm going to maneuver you a bit here. Right, and the triceps reflex, I'm going to get at the back of the arm here. So just let this relax. Keep it relaxed. Oh. There we go. And then just let me maneuver you here. We'll get the biceps reflex. Just putting my thumb in the crook of your elbow. Okay. You can just repeat that on the other side. Okay, you know the drill by now. Good, yep. Just make sure you're in the right position, and then we'll just come back here. Okay, and then, yep, you did that for me. Thank you. Very good. Okay. So, now I'm just going to take a look at your extremities. So, arms, hands, legs, feet. Have you had any soreness in any of the joints? The muscles, any weakness? Have the shakiness like I do maybe? No. Okay. Good. And yeah, the skin is all one temperature, warm to the touch. Dry skin. The other side here. Do you deal with anything like psoriasis or eczema? Mm-mm. Okay. Good. Right. And that side. Yeah, across the joints. And the arm and hands, all of that feels normal as well. So if I could have you just hold your hands like this, backs of the hands to the ceiling, splay the fingers, We'll just check out the nails. We want them to be pinkish with no lines or bangs or any sort of marks on them. We want the edges of the nails to be clear. I mean, they might be a little dry. You might have a hangnail or something like that, but we don't want to see any nodes. Just want them to be clear. Okay, so we're just going to check out all of that. Yeah, you got just a couple dry edges. Yep. That's nothing to be worried about. I don't see any staining or nodes or splits or anything like that. Do your nails tend to be pretty strong? Are they brittle? Okay. They don't like peel apart with the layers. Okay, good. So they're all good coloring, good appearance. Now, I'm going to squeeze each joint from distal to proximal, and let me know if any of that is painful at all. You have any issues with carpal tunnel at all? No, that's good. No repetitive injuries. That's good. I like to hear that. Just to make sure, I am gonna test your carpal tunnel area. Make sure there's not anything trying to crop up there. So, backs of the hands are smooth. If I could have you flip over your hands. And I'm just going to be tapping in this area and tell me if there's any zinging sensations, any pain, anything that feels a little strange. Okay, so nothing on the Tinel test there. Okay, we're looking for any contracture in the palm. Some people, they get this contracture where they can't lay their hand flat. It's very hard for them to hold things, but your hands are flat. And how is the thenar and hypothenar muscles? And how's the palm skin? Okay, good. All right, let me go ahead and just feel the pulses here. And we're looking more for quality, although all of a sudden your pulse is very high, then I would be a little curious as to why. Okay, other side. We'll just check in on this. Okay. Yeah, it's nice and strong. I don't even really have to press down that much. Very good. Sometimes if you are really observant, I don't know if you've ever noticed, but sometimes you can actually see your pulse. Sometimes I feel like it has to be, you need a little bit of shadow so you can see that minute bit, but if you hold your hand like this, yeah, it's right there. Isn't that interesting? So, let's go ahead and do your brachial pulse. And this is, there you are, right on the money. Good. Good. The other side. Yeah, 2 for 2, right? Immediately. It's not really a hard one, but sometimes it's a little elusive. Not like the popliteal pulse. That one you gotta go searching for with some people, but your pulses are very easy. Let's look at your legs. So, again, any skin abnormalities, especially with the shins? No. Okay. Any issues with the hips, knees, ankles? Okay. Then how about swelling in the feet? Okay, a little bit after a long day. Sure. And it does go away. Yes, very quickly. That's good. Okay. Would you mind just putting your foot up here? Doesn't matter which one. Okay, so we'll look at the top of the foot and the nails. And I'm gonna just separate each toe here. Sometimes you can get little wounds or lesions in between the webbing. That's why I had you splay your hands, so we could check that. And we can do dorsalis pedis here. Okay, and then I'm going to move up and do your post-hip pulse. Good. Good, okay. So, would you mind just... Yeah, I'm just going to hold your foot here so I can look at the sole of the foot. Couple calluses, nothing crazy, and no injuries. So, other foot. Good. Okay. And we'll just check this guy again, and we'll just separate the toes and do our dorsalis pedis pulse. Just feel the yep, post hip. Good. And then just look at the bottom of your foot here. What is this from here? Okay, stick got ya. It doesn't, it looks more like a scrape. Okay. Okay, it's pretty recent. Alright. It doesn't look very deep, but just want to make sure. Okay, and you can go ahead and put that down. And now, the popliteal pulse. So I'm going to use both hands, and I'm going to get under your knee, and I'm going to feel around the back side of your knee, okay? So this one can be tricky. Some people you can't feel it. Some people it's real easy. Oh, there she is. Just try to shift around a little bit. Nothing crazy. Okay, so we did not find anything that would be of concern, anything that I think would contribute to having what we believe is probably migraine, or even any sort of headache in general. So, we are going to refer you to neurology, and they would be able to give you a much better plan for treatment after determining what's really going on. But what I can do here is I can give you some just regular home remedy kind of things that would work regardless of if it's migraine or if it's just a sort of headache. I don't like saying just headache because those can be very painful as well. But migraine is different than just headache. So, the first thing I'd like you to do is, since I'm going to refer you to neurology, something that would be very helpful for them is if you keep a symptom log. This will help them with the diagnosis to see what exactly is going on. I want you to keep a log of when you have a headache or migraine, what sort of symptoms go along with it, whether you experience things before the episode, after the episode, as well as during. This would be like your sensory sensitivity, the fatigue that occurred before, during, and after the nausea. I want you to note the duration, when it starts, when it ends. If you notice if maybe there are any triggers. So this might be things like maybe you had a particularly stressful day, or maybe you ate something that you think isn't agreeing with you, or just really anything you could think of. Maybe just kind of what you were doing around the time that you had started getting the pain, and see if maybe there is any correlation at all, and any possible treatment that you do. So we'll talk about this in a second, but what kind of treatments you may employ and if they helped or if they didn't. So you can take ibuprofen, acetaminophen. One of those may work for you. Some people prefer one or the other. So you can try to do that and see if that helps. For some people it does, some people it doesn't, but that's valuable to know and can help figure out what's going on. As for things that are non-medication treatments, so because of your sensory sensitivity, as well as the fatigue and the nausea, it would be a good idea to rest with your eyes closed, or maybe with a sleep mask if it doesn't bother your sensory sensitivity, in a dark, quiet room. Just basically trying to reduce all sensory stimulus and not push through it. So that's going to make you more tired, more irritable. That can make the pain last longer as well. We just want to try to reduce all of our potential irritants. You can use either an ice pack or a cold compress on your forehead, or a hot pack on the back of your neck or on your forehead. Some people feel that ice works better. Some people feel that heat works better. It's very subjective. It's just what works for you. Some people, I'm not sure if this will work with your sensitivities, but some people, if they massage around their head, their face, their neck, that can help with the pain. Sometimes it's just even a distraction from the pain. And lastly, since stress can be such a big factor, I would like you to just kind of keep an eye on what's stressing you, if you can manage it, if you can reduce it, and of course exercise is going to be something that's helpful in general, but can be very helpful in this case as well. So outside of these episodes, just kind of check in and see what's going on in your life, and if you can implement more exercise and ways to lower your stress more, that's going to help anyway. Okay. All right, so do you have any questions, Tom? Okay, so we'll get you set up. The neurology office will call you to schedule an appointment, and then they'll be able to give you much better answers and hopefully a much better targeted treatment. Okay? Alright, I'd like to thank you so much for coming in today. I hope we can get this fixed and treated for you. It's not fun at all. I know that well. So, I hope you have a whale of a day and a good rest of your night.